Do you want to start and build your own hospital, or you already have your hospital and you want to grow that? If you are in any of this situation, then this video is for you. Today, I am going to talk about a comprehensive hospital setup checklist, which you will not find anywhere on the internet or in any books. I have completely covered all the aspects required for any hospital, and this checklist is going to be helpful even if you are starting a new hospital today, or you already have hospital. Then also this checklist is going to be super useful for you. So how you are going to use this video is that you need to, first of all, if you are a hospital owner, you have to watch this video and you have to share this video with your employees, particularly your department managers, so that they are also aware what all things are required for a successful hospital setup. And do not just watch this video, you need to go back and audit the same task in your hospital, because just by watching it will not help your hospital. You need to go back and plan and audit what all things are missing in that particular area, or what is the area of improvement related to that particular task. So do not just watch this video, you need to go back and take action, because if you are not taking that action, this is not going to help you. So if you are clear with this, let's move to this next part of the video. And if you are new to this channel, please subscribe to this channel. My name is Dr. Nitin, and I help hospitals to grow their hospital setup business. And if you are new, I will help you to grow your hospital setup. So I hope you have subscribed to this. Today I am going to discuss about only the checklist. That is, I will discuss only the high level points which are required for your hospital setup. I am not going to discuss individual checklist item, because this video will be very much long, and it will be very difficult to manage in this one video itself. So don't worry about this. I will be creating individual video for each single checklist. And if you need any particular help related to one checklist item, let me know in the comment section, so that I can prioritize that particular checklist item, and I will create that video on priority for you. So with this, let's get started with today's topic. My name is Dr. Nitin, and today we are going to talk about the most comprehensive checklist for hospital setup. So this is the high level checklist, what you can look at this. So what you need to do is that you need to have what I can say, a manager, particular staff, a manager level staff dedicated to look at this kind of activities or kind of tasks, because it's a very high level task. And within that, I will be discussing individual tasks. So you can see over here. So you need to have a dedicated staff or employee for this areas, and you need to have some dedicated managers for managing this kind of functions within your hospital setup. If you are clear with this, let's move to the next part, and we'll be discussing each and every department or every function in your hospital setup. Let me remind you, this is going to be a most comprehensive checklist for your hospital. So if you are building, or if you are in the process of planning for your hospital setup, this is going to be useful. And even if you have your existing hospital setup, then also this video is going to be super useful for you. So watch this video till the end of this, so that you do not miss a single point, and because you might miss that single point, and that may impact your hospital setup quality. So please do not miss, and we'll go through each and individual all checklist, and we'll discuss one by one all the checklist item individually. So let's get started with this. Let me go to my first item in the checklist. And if you have not subscribed to this channel, please subscribe to this channel so that you do not miss any future detailed tutorial on each checklist item. And let me remind you, for today's video, this video is going to be super lengthy, so please be patient, but this is for benefit of your hospital setup. So that's why you need to be patient and be focused about this video. I hope my screen is visible to you. So when it comes to infrastructure and facilities for in-hospital setup, you need to consider the land and building, zoning and land use approval, design and layout compliance, utility services, fire safety measures and norms, waste management system, parking facilities, accessibility and signage, waiting areas and patient rooms, infection control and measures. Let me remind you again, today I am going to discuss only the high-level checklist, and I will be creating a detailed video on each single checklist item. So if you want to know about any particular checklist item, let me know in the comment section so that I can prioritize that checklist item and I will create that video for you. Then after this, there comes the list of regulatory compliances, and those compliances includes the registrations and licensing requirements, various accreditation standards, medical council approvals, biomedical waste management, and your pharmacy license, clinical establishment act compliances, radiation safety norms, drug and cosmetic act compliance, consumer protection act compliance, ethical committee approval. As I mentioned in the beginning of this video, what you need to do is you need to share this video with the responsible person in your hospital so that they can take care of their own individual department or function, because as a hospital owner you may not be able to look at all these checklist items. So that's why share with your colleagues or your employees or staff or your team members so that they take care of their own responsible area. Okay, then let's move to this next checklist item, that is healthcare personnel, in which you need to have qualified medical practitioners, nursing staff, paramedical staff, administrative staff, support staff, allied health professionals, specialists and consultants, trained emergency response team, infection control staff, continuing medical education program. So if you are with me till in this video, that is very nice, because it shows that you are serious about your hospital growth, and I request you to continue watching this video so that you know rest of the compliances that are required for your hospital setup. You will require medical equipment and technology, in which it includes diagnostic equipment, treatment and surgical equipment, radiology and imaging systems, laboratory equipment, telemedicine facilities, EHR system, that is electronic health records, emergency and life support equipments, information technology infrastructure, centralized monitoring systems, and telecommunication systems. So I hope you are enjoying and learning from this video till now. Let's look at the next checklist item for administrative systems and processes, which includes patient admission and discharge procedures, billing and revenue cycle management, health information management, human resource policies, staff training and development, inventory management, maintenance and assets management, quality improvement processes, legal and ethical compliances, then complaint and grievance handling system. So these are the few of the checklist items. Let's move to the next checklist item set, which is for emergency services and protocols, and which includes emergency room facilities, trauma care infrastructure, ambulance services, disaster preparedness, emergency response team, protocol for trial and trial management, rapid response systems, communication systems for emergencies, emergency medical services training, collaboration with external emergency services, critical care units, and on-call specialist. I hope you are with me in this video till now. This shows that you are keen to grow your hospital setup. So let's look at few more parameters which are required for your hospital setup requirement, which includes quality assurance and accreditation, and that comprises of quality assurance programs, accreditation standard compliances, clinical audit processes, patient safety measures, outcome measurement systems. These are majorly clinical outcome measurement system, peer review mechanism, accreditation body registration, then benchmarking practices, documentation and reporting systems. Hi guys, I hope you are with me, and as I mentioned, it will be a very lengthy video if I cover each and every checklist. So that's why I have created a high level checklist item, and I will come back with a detailed video on each single checklist item, a separate video. Let me know in the comment section which checklist item you are interested to know more about. We'll move to the next set of checklists, which includes patient services and amenities, and under which you need to take care of patient admission and discharge services, inpatient and outpatient facilities, patient education programs, language and communication supports, waiting areas and comfort facilities, dietary services, transportation facilities, visitor accommodations, patient advocacy services, palliative and hospice care services. In this digital world, how we can forget about information technology, which includes EHR, that is electronic health records, health information exchange, telemedicine and remote consultation, hospital information systems, PAC system, that is picture archiving and communication systems, then laboratory information systems, radiology information systems, telecommunications infrastructure, data security and privacy measures, IT staff and training. Then you need to consider one of the critical components, that is financial management and sustainability, that includes budgeting and financial planning, revenue cycle management, insurance and billing systems, cost control measures, hospital reporting system, financial reporting systems, compliance and audit processes, fundraising initiatives, investments and capital planning, public-private partnership, economic viability assessments. And let's move to the next aspects, which majority of the hospitals and even consultants, they are missing on this point. If you are with me, I am sure that you will not require a hospital consultant for your next hospital project. This checklist is more than enough to understand and take your hospital business to next level. And what you need is marketing and patient outreach systems, which includes branding and position strategies, branding and digital marketing initiatives, community outreach programs, health camp and screening, referral and network and partnership, public relationships and media presence, patient testimonials and success stories, educational workshop and seminars, loyalty programs for your patients, feedback and survey mechanisms for your patients. Okay, so that was the very tiresome and comprehensive list, but I'm sure that if you follow this video and implement one by one all the checklist item in your hospital setup, your hospital is definitely going to next level. And it not only help new hospital business owners, but even if you are already running an established hospital setup, I am sure you will definitely have got something to help your hospital business. So if you have liked this video, please give a thumbs up and like to this video, and share this video with your employees, your hospital manager, hospital staff, so that they are also taking ownership of their respective departments or functions. And it's not a single man's task. It's not only the hospital owner's responsibility. As a hospital employee or hospital staff, it is a collective initiative to grow that hospital. And if you have got some value from this video, please let me know in the comment section what is the next system or what is the checklist item that was missing in hospital setup, and that you were able to manage, or you will be able to get some idea from this video. And if you need more guidance related to this checklist, as I will repeat again, let me know in the comment section. I will create detailed item on that checklist item. And if you are not subscribed to this video channel, please subscribe to this channel so that you do not miss the next detailed checklist video item video. And I hope you found this video is useful. This is Dr. Nitin signing out.